So I'm Dick Jackson, I'm a pediatrician, and for 30 years I did environmental health. I worried about things that were very small, molecules and chemicals in our environment, that things like cause lead poisoning, endocrine disruptors, and all the rest. I worried about things that were very big, like the destruction of the chemical weapons of the United States government, the safety of cruise ships, the melting of the Arctic ice caps. And about 10 years ago, I just really confronted the fact that human beings spend almost their entire lives, our entire lives, in built environments. Even the vehicles we spend time in are built environments, and it has a huge influence on our health and well-being. Ended up doing a book on urban sprawl and public health that Jeff mentioned briefly, and our latest book and the textbook I use at UCLA is Making Healthy Places, and the companion book for the television series, and maybe I can get it to air towards the end, is Designing Healthy Communities, and this is the flyer for the video series. I'm very pleased it's shown in over 2 million homes around the United States at this point in public broadcasting, and WNET Channel 13 in New York with about 14 million viewers will watch it in May during relatively good prime time. I don't know if the University of Oklahoma had this ad in your school newspaper on October 11th of 2011. Now, General Motors, you know, as Jeff said, 1/4 of the entire economy of the United States is built on cars. I guess Chris Lineberger said that. General Motors probably did some very deep focus group testing. They had smart people on the other side of mirrors and were interviewing college kids. What's your life like? How's your budget? How are you paying for things? How do your future prospects look like? What's your home life like? What's your love life like? And the feedback they got was, reality sucks. So really smart marketers take something that really resonates with people and they start their marketing campaign based on what people were feeling. And this is their campaign. Reality sucks, but it doesn't have to. The GM college discount doesn't. You can stop pedaling, start driving, and you can pay $30,000 for a GMC Sierra and have 7 years to pay it off. And all of a sudden, pretty girls will not smirk at you anymore because you are saving money, exercising, not polluting, and not adding to congestion because you'll be driving a GMC Sierra. Well, I was very upset about this, and about 1,000 other students at UCLA were, and they all Twittered and sent notes to GM, and GM pulled the ad. But when I showed it to my students, one of the young women in the class said, "Dr. J, you don't know anything. She's not smirking at him. She's flirting with him. She doesn't want to be with the flabby guy driving the car." So, but GM was right, because underneath all of this is some very worrisome health data, which is a good reason for the two gentlemen after me, because they're going to be talking more about solutions. I'm going to be talking about the problems. This is a big deal. When you see a 4-fold increase in the consumption of antidepressants in the United States for people in the prime of life, when they ought to be feeling best, and we've seen a 4-fold increase in 20 years of antidepressant consumption, there's something going on there. We've seen this in more objective data when CDC interviews about 200,000 people per year, and one of the questions is, how's your health? And we've seen a 14% decrease in people saying my health is really good over that same period of time. So I was a kid growing up in Newark, New Jersey, garden spot that it was, and in 1955, on a hot August day, was the opening of Disneyland. And we all sat there and watched as Disneyland, they had Tomorrowland and Frontierland and Fantasyland and Main Street USA, where people paid $20 to see people walk on sidewalks and go through downtown areas. And if you watch that on YouTube, the camera pans back at one point, and Highway 5 is going by. It's a freeway. God, I never heard of a freeway. And it had 5 cars on it. Well, I'm sure everybody else in New Jersey thought the same thing. I'm getting the hell out of New Jersey. I'm going to go to a place where they have Fantasyland and Tomorrowland and have free roads and no cars on them. This is great. Well, everybody did, and this is what the road down the street from UCLA looks like now every morning. And no meeting at UCLA, no meeting starts without someone saying, I'm sorry I was late. There was a wreck on something, because it is totally gridlocked. By the way, Los Angeles has higher density population than New York City, believe it or not. So I said I'm a pediatrician, and I'm sure there's a child health care provider in this room, or obviously parents. I said, what is the thing you worry about most? Oh yeah, hepatitis, meningitis, pertussis. What we all really worry about most, doctors and everyone else, is the one thing that can take a bright and lively child and make them inert in 5 seconds, namely car crashes. The leading cause of death for young people in America is car crashes between ages 3 and 34 years of age. And the way you increase your actual risk of dying in a car crash is about 7 in 1,000, so it's close to 1 in 100. It's actually considerably higher in Oklahoma than it is in New York City, but it is one of the leading causes of death in America. How many of you will drive or have driven 87 miles today? Okay. How many of you have ever bought a lottery ticket? Your 1 in a million chance of dying today is driving 87 miles. Now, the women in this room don't know this, but half the people in this room think they're better than average drivers. And you know which half it is. It's the guys, right? We all think, oh, it's not going to happen to me because I'm a good driver and I'm really careful. But it's actually, more times you drive 87 miles. Every time I drive from my home in LA to my wife's home in Berkeley, I buy 4 lottery tickets for death. If you build a city that forces people to get in the car and drive all the time, their risk of dying is higher than if you live in cities where you don't have to be in a car all the time. And the sprawl cities have much higher death rates than the cities that are not sprawl cities. So Atlanta's 13 and New York is 2.5 per 100,000 deaths per year. If the fatality rate in the whole country was the same as New York City, we'd save 24,000 lives a year. If it was the same as Portland, we've talked a lot about Portland, we'd save 15,000 a year. And I spent 10 years working at CDC in Atlanta. Every day I saw a fresh car wreck, and if the whole fatality rate for the country was the same as Atlanta, we'd kill an additional 15,000 people per year. What you build is a major determinant of how long you live. And in fact, we often say in the video, tell me your zip code and I will tell you how long you're going to live. Well, it isn't quite so bad for pedestrians. I mean, it's 2.5, or we talked about Dallas earlier, 3 1/3 deaths per 100,000 in Dallas for pedestrians. And that's not a whole lot more than New York and San Francisco, about the same as San Francisco. There's a fallacy here, which is that Dallas has not discovered pedestrians. And if you actually calculate it on the basis of how many people are walking, the cities that are designed only for cars, those high-speed one-way roads, have much higher death rates, 122 in Houston. UCLA has decided it's going to be the healthiest campus in the United States. It's okay if we fail, but we're going to try damn hard. In the first year, we got rid of smoking on the entire campus, and I'll tell you, those humanity majors and history majors from Eastern Europe thought we were a bunch of crazies, but we have gotten rid of tobacco from the campus. We've gotten rid of junk food from all the cafeterias, and no soda machines have sugared solutions or high caffeine solutions any longer. I'm the lead on the built environment, so I've been pushing hard for making the campus highly bikeable. We had 18,000 car parking spaces and 1,100 bicycle parking spaces, and then wondered why people didn't want to bike. The surrounding areas aren't great for biking, but we had to fix our own neighborhood first. So one of the other things I was pushing is 20 is plenty. And if you're hit by a car as a pedestrian, by a car going 20 miles an hour, you have a 5% chance of dying. If you're hit by a car going 40, you have an 85% chance of dying. So I was telling the chancellor we need to put the speed limit at 20 miles an hour. And they said, well, yeah, slow people down getting across campus. So I calculated it's 23 seconds difference getting across campus at 20 miles an hour versus 40 miles an hour. No one needs to go across an urban campus at 40 miles an hour. I then insisted the police department for UCLA get radar guns. And they said, oh, that'll really piss people off. We shouldn't do that. And I said, I finally used one of my grants, and I bought them radar guns. They still aren't using them yet, but we're going to get radar guns in all of our campus police. What do you think the most prevalent chronic disease is? I talked about the leading cause of death. What do you think the most prevalent chronic disease is in children in America? It's asthma. It's been going up and up and up. There's lots of arguments why it's going on, but breathing bad air is not good for you. If you live on the side of Los Angeles that's highly air polluted as opposed to the ocean side, the rates of asthma are considerably higher. Here was a study done of high school kids. These are your 8th grader goes off to high school, and this kid's going to do 3 different sports, and you are really proud. And that child does 3 sports all the way through high school. If they went to a high air pollution high school, they had 3 times the asthma rate at the end of high school compared to when they started, compared to the kids that went to low air pollution areas. Bad air is not good for us. And what is the leading cause of bad air in the United States? It's vehicle exhaust. Far and away, it's vehicle exhaust. It's why we need to really change the fuel mix and all the rest. We did a natural experiment in Atlanta. We told people not to go downtown during the Olympic Games. And people didn't drive. They took the metropolitan Atlanta. They walked a lot. The city was packed with people. One of the docs thought, gee, I'll look at asthma admissions in the hospital during the Olympic Games, both before and after and the year before, and found the kids going to the doctor for asthma, going to the emergency room for asthma, dropped dramatically during the Olympics. Natural experiment, not chambers or anything, artificial, just real-life data. How many of you heard of Carmageddon? It was all over the news. So remember, this is California, right? And we have this huge highway, the 405, that goes from the San Fernando Valley into LA. And there's a couple million people up there. They've all got jobs down here. And every morning, this huge number comes across the pass. And so Caltrans, apropos of Jeff's speech earlier, decides, we got a bunch of recovery money. What were we going to do? Well, I think I might have wanted a light rail going up the middle of the road and starting to put people on the light rail to go the 15 miles between the valley and Los Angeles itself. But instead, Caltrans spent billions and billions and billions of dollars widening the road. Well, they couldn't widen the road right underneath the pass here, so they had to drop that bridge onto the road, and they trucked in about 15 feet of sand and dynamited it, and they actually stopped the road before they did that. And we all thought this is going to be the end of Los Angeles. No one will be on the 405 freeway. The day came. Everybody stayed home. They biked to the beach. They hung out with their family. They played softball. The city was really a lot of fun during Carmageddon. So one of my faculty said, gee, I wonder what happened to air quality. So she went out and she started to measure it. And this is the headline from, it wasn't Carmageddon, it was Carmaheaven. With the closure, air quality during Carmageddon, close to the highway, improved 83%. So campus air quality got better 83%. The whole western side of Los Angeles, air quality got better 75%. And the whole region, that enormous basin, got better by 25% simply by reducing the driving. I think, and Jeff talked about this, I think the paving over America and disappearing of green space, there are kids in parts of Los Angeles who have never seen a park. In Beverly Hills, there is about 40 acres of park for every 1,000 people. In South Central LA, there is virtually no park for 100,000, 200,000 people. In fact, one of the things I teach my students is the built environment is social policy in concrete. So if you're wealthy, you know, you want those parks, and those poor people don't have the same power or otherwise, they don't get the parks. And by the way, if it's social policy in concrete, it stays in concrete for a long period of time. This is from Richard Lou's article in the New York Times. I like to play indoors because that's where the outlets are. We'll come back to this a little bit. This is an article that came out 2 days ago. Do you think having a child living in a box, being put in a box, taken to school in a box, being in a box at school, eating standing up in the cafeteria, often fast food, being put in a box going home, told not to go out after school, and then wondering why the kid is fidgety all the time. 20% of teenage boys in America taking stimulants for hyperactivity? My grandmother knew how to deal with hyperactive boys. Get out of the house. Go run around. You can come back in when you get rid of all that excess energy. And I'm not saying that some of the kids need it, and as a pediatrician, I have prescribed it, but in general, I think we've been much too quick to give it out when we have good environmental interventions that work just as well. The president cited this article that just came out a couple of days ago. Fascinating. They put these hair nets on people that had electrodes in them, and they had them walk around parts of a European city, and they could measure the electrode activity in really sort of friendly urban areas, and it was a certain way. Then they walked into really garish, difficult, hardened landscapes, and the electrical activity got all jazzed up and was much more difficult. And then they got to green space, and it calmed right down, and people could attend. You can't be high attention all the time. By the way, my students tell me, after I do something especially stupid, Dr. J, don't you realize that multitasking makes you stupid? I say, yes, I won't do that again. The Academy of Pediatrics writes positions on what drugs you ought to take, what medicines to give for otitis media, what you give for meningitis, on and on and on. This is the very first statement we ever wrote. And this is 80,000 pediatricians. They're not a bunch of crazy radicals. They're nice people. They wrote a position paper that said, children need to grow up in neighborhoods where they have increasing autonomy, increasing ability to run their lives. And you know, what you need at age 5 is very different what you need at age 12 and 15. In fact, if kids don't have safe risk-taking, they do stupid risk-taking. And as a parent, you all know you want your kids to be challenged enough that they're not bored, but not so challenged they fail all the time. And I would say that having your child depend on you to take them absolutely everywhere at age 16, you know, take me to the mall, take me to church, take me to the store, and then at age 17, handing them the car keys and expect them to be totally autonomous, self-determining adults is craziness. So I'm going to talk about obesity, and I did a little bit. I didn't realize Oklahoma was so high on the obesity scales for the country. And how many people in this room have seen these maps? So about half. I'll go through them quickly, and I apologize. I'm going to tell you a secret right now. They're wrong. CDC calls up and interviews 200,000 people a year, and they ask them, you know, how you feel and how much you weigh and how tall you are. And so here's Oklahoma in 1991. Oklahoma in 1997, about 10 to 14% obese or overweight. 2009 at about 29%, and the same in 2010. Average Americans gained about 27 pounds. I think I have what I've just shown you is not true. So researchers at Harvard went back and they found a bunch of people that had been called in the interview. They had them come in. They said, how tall are you? And the guys got shorter and the women got heavier. And then they actually measured them. It was even worse. And so this is a comparison of what people tell you on the phone and what they actually are. If you read my driver's license, by the way, I'm 6'2" and 180 pounds. But where I'm going with this is that as worrisome as that data is, the actual data is even worse on the obesity changes in our population. And we're tracking at about 30% of our population having 11% of our population having body mass indexes over 40. That's 100 pounds overweight. You may have the finest doctor in America, but if you're coming in at 100 pounds overweight, she's having a hell of a time trying to take care of you. It's just not going to work. Technical slide, I'll go through it quickly, but the bottom line here is, as our body mass goes up, as our weight goes up, our risk of becoming diabetic goes up. And the dark line on the bottom is how the risk goes up for men, and the other colored line, the teal, is how it goes up for women. You can see the risk for diabetes for women going up dramatically as the body mass index goes up. So here's the map in 1994. About 4%, 5% of Oklahoma being diabetic. And 2007, about 8, 9%. There are states now with 10%, 11% of its population with a disease that will cost their people their eyes, their kidneys, and their feet. We're now spending 2% of the entire gross domestic product of the United States on nothing but diabetes alone. And 2 out of every 7 volunteers for the US military cannot get in because of lack of fitness and obesity. And so the generals are worried about this, the Pentagon's worried about it. It's not simply the pediatricians and the doctors. Well, geez, if we had a bunch of good doctors, we could deal with this and everything would get better. We're spending close to 20% of all the money in the United States on medical care. My son is a doc, but when he was young, he did a rotation down in Costa Rica. And he sent me a message and he said, Dad, they spend 7 times less money on medical care in Costa Rica than we do and live exactly as long as we do. Because we're spending it on things that really don't prevent. Life expectancy has not improved, so given how much money you spend. You have not seen this slide. Some of you have seen other slides before. You have not seen these before. This is an article that came out about 2 months ago in the Journal of the American Medical Association, the status of baby boomers' health in the United States. This is CDC Interviews, not only 100,000 people on the phone, they also do physical exams, blood work, lab exams on about 5,000 people a year. They went back and looked at people ages 46 to 64. It's called NHANES. They looked at the data from 20 years ago, and they looked at the data from about 5 years ago. What portion of the population do you think said they were in excellent health 25 years ago, and what portion, same age people, say they're in excellent health pretty much now? 32% down to 13% in that short period. It's less than 1 generation decline in people saying they're in excellent health. This is the same time we've doubled how much money we're spending on medical care. You have a limitation in how you can function, an increase in that. How many people need a wheelchair or a cane to go around and deal with their lives? Same age people, 3% to 7%. Lifestyle factors. Smoking's gone down. That's great. Obesity's gone up. You knew that. Look at this next one. People saying they get no regular physical activity, 17% up to 52%. Part of this is obesity, because if you're really overweight, you don't want to do the same amount of physical activity. But part of this is we have created an environment. It's exactly what Jeff was saying. We've created an environment that makes it hard for people to be physically active and to build it into their daily lives. Being physically fit's good for us. This is a study of, my wife's mother was in this study of 100,000 nurses followed for 40 years, and I'll just quickly show you the summary of it. The nurses who became obese had a 90% increase in their death rates over time, but the nurses who stayed thin but became unfit had a 60% increase, and the nurses who became unfit, inactive, and obese had a 2.5-fold increase in death over the same period of time. So anything you do to deprive people of their ability to use their bodies to be physically active is depriving them not only of liberty and happiness, you're depriving them of life. A middle-aged man starts to become fit. He can increase his lifespan almost as much by becoming fit as if he stopped smoking. That's how effective fitness is. About 5, 6 years, 8 years to go from low fitness to moderate to high fitness. I'll skip these, but you all know that our percentage of kids walking to school, and with the decline in the number of children, it may be necessary that we have great big schools, but we make it excessively difficult, even when a child does want to go to school, to make them capable of walking and biking to school. Do you think the reduction in kids walking and biking to school has affected their fitness? Oh, you bet. Do you have the fitness gram in Oklahoma on the report card? Here's a recommendation. I don't recommend you put the body mass index on the report card, but a kid ought to be able to walk a 12-minute mile. They ought to be able to do about 5 other physical fitness things, and it ought to be on the report card. It ought to be reported to the parents, and the schools ought to be competing over who can meet the fitness gram requirements most effectively. And by the way, the schools that are doing well, the principal goes out 3 times a week and does a 1-mile walk with all the kids. It's a social event, and they've seen big increases just in that 1-mile walk in doing it. Of course, we put schools in places that are totally unwalkable, but it's at least a goal to do it. Only 37% of our high school kids can pass the fitnessgram, but that's better than it was 5 years ago when it was 25%. Yep. So one of the things I teach my students is, if it's boring, it's important. And what I mean by that is, so I did a lot of meetings with the legislature and Congress and everything else in my various jobs. I was state health officer under Schwarzenegger. And the Senate Rules Committee runs the Hill. Well, that sounds completely boring. Office of Management and Budget runs Washington, D.C. What could be more boring than management and budget? So the Institute of Medicine came out. They were asked to look at the obesity epidemic and how to turn it around. This is the report from a year ago. They had a dozen recommendations. Recommendation 1, communities, transportation officials, planners, health professionals, governments should make the promotion of physical activity a priority by increasing access to places and opportunities for such activity. This is a bunch of white coat doctors. This isn't a bunch of transportation people. It's the same set of recommendations. Kaiser Permanente is running a campaign to get people to take the stairs. And when I was health officer, we got all new state buildings to have pleasant, attractive stairways and you walk in rather than elevators right there. I just don't know how Kaiser got this past their safety people. But every city pretty much has a master plan or a general plan. Every state has a constitution for growth and a general plan for the state. What we're doing, working very hard in California, is that the touchstone and the basis of all future planning in our state, many of our counties and cities, is that it's health-based. And what you do, how does it affect big health, not simply the other? Our young people are on fire with this issue of built environment and health. American Public Health Association meeting 10 years ago, there wasn't a single presentation on built environment or land use. What do you think it was last year? 102 presentations on land use and 180 on built environment. And there are joint programs cropping up all over the country. So I'm almost done, and I won't steal your point, Rob, but so I was at Washington, D.C., and I came out of Union Station. There's this beautiful bike place where you can rent bikes and even buy some bikes, and I thought, geez, this is great. And I was taking some pictures, and I noticed over on the side 2 police vehicles. And I said, gee, that's very interesting. I wonder what they cost and how many calories you burn when you're on these. So I did a quick calculation, and one costs 7 times as much, 5 to 7 times as much as the other one. Probably needs much more repair than the other one. And one uses 3.5 times more calories per hour as the other one. So I figure every time you're on the mountain bike, police officer, you are burning off about a pound a week, about a pound every 3.5 days that you're on the mountain bike. This is sort of quintessentially American. We find a technological fix for what in fact could work perfectly well by using our bodies. I do like the fact that the police officers on the Segway are fatter than the police officer on the mountain bike. And have you ever noticed that I always talk to the police officer on a mountain bike or on a horse, but I never talk to the police officer in a squad car or in a Segway? Charlotte, North Carolina. And Jeff was saying build downtown first. I think the other thing is light rail, light rail. I'm a big believer in it. Charlotte, North Carolina used some money to build its light rail. People started to take it to save money, to read a book, to talk to their neighbors, to be less stressed. They went back and looked at almost 1,000 people, at 1,000 locations, both before and after the light rail went in. And this is the study that came out. People that took the light rail met the Surgeon General's requirements for doing physical activity, or recommendations. But this is my favorite part. They lost about 6.5 pounds 2 years later. They didn't even know they were on a weight loss campaign. They thought they were simply saving money. This is a technical slide. I won't go into it too long, but we make big decisions, and every planner in here knows what the National Environmental Policy Act is. They know what an environmental impact statement is. They are completely inadequate to look at human health. And we need to look at what's happening to mental, physical, and social health when we put things in place. So when Charleston was going to put in a bridge over the Cooper River. Big push by the public. We want a bike route. We want a walking trail on the side of the bridge. No, 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 said the transportation engineers. No, 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 said the accountants. It will cost too much money. The people insisted on it. They said, we really want this. It's a way to go to work. It's a way to have recreation. A few years later, it was finally built. It is the third most popular tourist destination in Charleston now. And there's a larger point, and I'm sure my colleague here will talk about it. The issue of bicycle tourism, I think, is going to take up much more for particularly people my age. You know, we like to eat, but we'd rather go to a place where we could bike all day long and then have a nice dinner. Would you like to go for a walk here? Sit down, have a cocktail, have your 3-year-old play next to you. When this is the Chinoge Freeway in Seoul, South Korea, the community demanded that it be ripped out and that the river underneath be exposed. Cost $1 billion. This is what they built. You don't need to tell people to go for a walk. You don't need to tell kids to go run around when you create places that people want to be active both day and night. When I was a Boy Scout, actually my kids were Boy Scouts, they'd go around, they'd do these stencils about, you know, peeing this on sewers and stuff. Well, as a lead-in to our next speaker, I will suggest that we need to stencil this all around Oklahoma City. So with this, let me stop, and I'll, the story I gave you is discouraging. We cannot afford to continue on the track we're on in terms of our health, in terms of our economy. We've got to turn it around. And one of the best ways to turn it around is to build incidental and useful physical activity back into their lives. Thank you all very much.